This is PediaCast.
Welcome to PediaCast, a pediatric podcast for parents. And now, direct from the campus of Nationwide Children's, here is your host, Dr. Mike.
Hello, everyone, and welcome once again to PediaCast. It is a pediatric podcast for moms and dads. This is Dr. Mike coming to you from the campus of Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 516 for April 14th, 2022. We're calling this one Anxiety in Kids and Teens. I want to welcome all of you to the program. So we have another important topic for you this week as we consider anxiety in children and teenagers, which is a very common thing in normal times, but we all know that these are not normal times. We're still feeling the effects of a global pandemic. There's a war in Europe, and kids and teens continue to deal with schedules and school and sports and friends and bullies and family tension, and in many cases, jobs. It's a lot. And then you throw an underlying anxiety disorder into the mix, and things can become really difficult very quickly. So what can parents do to ease the burden? And what is the role of primary care providers and schools, psychologists, psychiatrists, counseling, and medication? We'll consider all of these things as we share everything that you need to know about anxiety in children and teenagers. To help us do that, we have two terrific guests joining us in the studio today. Dr. Ariana Hoet is a pediatric psychologist at Nationwide Children's Hospital, and Dr. Kristina Jiner is a pediatric psychiatrist at Nationwide Children's. This is their first time in the studio together, but it will not be their last. They're going to be joining us on a regular basis as we consider a wide range of pediatric mental and behavioral health conditions moving forward. Anxiety is the topic today, but we'll have much more to explore together in the weeks and months ahead as we add our behavioral health panel to the podcast mix, and you'll hear from that panel for the first time today, so that is exciting. Now, as a reminder, behavioral health has always been an important topic on PediaCast, and if you head over to SoundCloud, you'll find a behavioral health playlist with over 25 episodes on it, so hours upon hours of trustworthy content as we explore behavioral health concerns relevant to children and teenagers. And to help you find that playlist easily, I'll put a link to it in the show notes for this episode, 516, over at PediaCast.org. All right, before we consider anxiety, let's quickly cover our usual reminders. Don't forget you can find us wherever podcasts are found. And if you like what you hear, please remember to subscribe to our show so you don't miss an episode. Also, please consider leaving a review wherever you get your podcasts so that others who come along looking for evidence-based child health and parenting information will know what to expect. We're also on social media. We love connecting with you there. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. We also have a contact link over at the website at PediaCast.org if you would like to suggest a future topic for the program. We'd encourage you to connect there and let us know what you want to hear. Also want to remind you the information presented in every episode of our program is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. If you have a concern about your child's health, be sure to call your healthcare provider. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at PediaCast.org. So let's take a quick break. We'll get Dr. Ariana Hoet and Dr. Kristina Jiner settled into the studio, and then we will be back to explore anxiety in kids and teens. It's coming up right after this. Dr. Ariana Hoet is a pediatric psychologist at Nationwide Children's Hospital. She serves as clinical director of the On Our Sleeves movement, more on that to come, and she's an assistant professor of pediatrics at The Ohio State University College of Medicine. Dr. Kristina Jiner is a pediatric psychiatrist at Nationwide Children's and an assistant professor of psychiatry at Ohio State. They are both passionate about treating and supporting children, teenagers, and families impacted by mental and behavioral health conditions, including anxiety. That's what they're here to talk about, anxiety in kids and teens. So let's give a warm PediaCast welcome to our guests, Dr. Ariana Hoet and Dr. Kristina Jiner. Thank you both so much for visiting us today.
Thank you for having us.
Yes, great to be here.
Yeah, really appreciate both of you taking time out of your busy schedules. And as it turns out, I mentioned this in the intro to the program, but we really have a new series within the series of PediaCast. We're going to be doing quarterly episodes on mental and behavioral health conditions with both of you. So the audience is going to get to know you pretty well, and we're really excited to embark on this journey together. Before we get into anxiety, I did want to talk a little bit about the difference between psychology and psychiatry, since Ariana, you're a psychologist, and Kristina, you're a psychiatrist. So why don't we just start with sort of, who you are, what your role is within the mental health field. And Ariana, if you want to go first and tell us about psychology.
So on my end for psychology, I went to graduate school to get to the training and practicing where I am today. So I had to do a doctoral in clinical psychology, and that way I am able to practice as a therapist, do evaluations for things like learning disabilities or diagnostic evaluations. But unlike a psychiatrist, I do not prescribe medication.
Okay. So really your emphasis is more on counseling. I think folks have probably heard about cognitive behavioral therapy, talk therapy, those kind of things. That's really where you specialize. Yep. And then how is a psychiatrist different from a psychologist? Kristina?
Sure. So as a psychiatrist, I'm a medical doctor or physician. So I trained at medical school first, and then went on and did additional training in psychiatry and then child psychiatry. And in addition to evaluating for mental and behavioral health issues, I can also prescribe medication. I have some training in therapy, but that's not what I spend the majority of my time doing.
Yeah. And you can also admit kids to a hospital if you would need to, and kind of manage them from a medical sort of standpoint, in addition to the behavioral counseling kind of stuff too, as well. All right. So that's kind of the difference in psychiatrists and psychologists. Let's go ahead and move into the topic at hand, which is anxiety. And Dr. Jiner, what do we mean by anxiety? What's a good definition for that?
Sure. So I think of anxiety as the body's reaction, and that includes mind and the rest of the body's reaction to a situation that is stressful, situation that's new or unfamiliar or dangerous. And so it includes both how the body physically feels, as well as how the mind thinks about it. And anxiety also includes worry or concern about a future dangerous situation or future unfamiliar situation.
Yeah. So to some degree, anxiety is a normal human response to lots of things. So what's the difference between what we would consider normal anxiety and when now the anxiety is a problem?
Absolutely. That's a very great point. So as I always tell everyone, anxiety actually keeps us alive. It's what, worries about getting hit by a car is what kind of prompts us to look both ways when we cross the street. So how do we know when that crosses over? And so there's kind of two things I look for. One is the anxiety that's showing up in a situation that isn't dangerous. It isn't a reason to have fear. Or the situation maybe is somewhat dangerous or somewhat fearful, but the response to that is above and beyond what is expected. And the kind of overarching theme is there impairment? So is this causing me a problem or a child a problem in day-to-day life?
Yeah, that makes sense. So when there's an issue with the child's behavior, with their sleeping, their eating, their mood, their schoolwork, if it's something that their anxiety is impacting the quality of their life and the quality of the lives of people who are in their sphere of influence, then that's a problem, right?
Absolutely.
But, having anxiety because you're afraid of a thunderstorm that's coming, that can be normal.
Absolutely.
For kids. And Dr. Hoet, or how common is this condition of anxiety and who's affected by it?
So as Dr. Jiner said, we all can feel some form of anxiety, stress, fear. when it comes to anxiety disorders, it's one of the most common pediatric diagnoses in children. So according to the CDC, about 4.4 million children are affected by anxiety disorders. And that was before the pandemic. So that may have even increased since then.
Yeah, absolutely. So I think that ends up being like 10 to 20% of the population. So that's a lot of folks who are impacted by anxiety. And I would suspect it's one of the more common things that you see.
Yes, absolutely.
Yeah. I wanted to kind of go through the age groups and just see what anxiety looks like at each age group. And then what are the most common sources and sort of what are some good treatment strategies or management strategies. And I wanted to start in babies and toddlers because, there's a condition called separation anxiety. And so that affects babies as they get to kind of get used to who's around them and, who's mom and dad and who's members of the family and who are strangers. So talk a little bit about anxiety in babies and toddlers.
I do think it's important we start since infancy in babies and toddlers because we all feel emotions at a very young age. And so perfect example is this. An infant can recognize the difference between a face that they know and a stranger's face. And so they're going to have that stranger danger that we call, right? That fear if they see someone new. And toddlers are also going to start feeling that separation anxiety for the same reasons. They know what's familiar and who's new, and they have that fear of the unknown and the new things. Older toddlers, you may start to notice specific fears too, the dark, things like that. They start to understand a little bit more, and so they're going to show a little bit more of that fear. But it is incredible. And even for me as a parent, I've been surprised how my 2-year-old is starting to show certain fears and how she describes it too. It's incredible. Yeah,
absolutely. So then when would you consider like the separation anxiety normal and when is there a problem with it?
It's normal again at the toddler stage. If we start to see that it continues past toddlerhood, or as Dr. Jiner said, it becomes impairing. So a child may experience fear separating from their parent, may be nervous at first, maybe cry, but then if it's taking a very long time for them to calm down, or we cannot do anything without being together, then that's when we start worrying that it's a little bit more than the normal anxiety.
Yeah, that makes sense. You think about the kid who they're going to a new babysitter's house. And so, they basically cry all day while mom is gone. But the hope is that after a week, they start to get used to the people that are in this new place. And so that's just going to sort of get better on its own. But if it's interfering with, mom gets called back from work to come pick the child up, and then that starts to happen over a long time, and now mom's job is in jeopardy, then now it's impacting the family, and we may need to figure out some strategies, right?
Exactly. I always look for progress. Is the child crying for less and less periods of time? Are they becoming more used to the new environment? And then just like you mentioned, if it's so severe that we have to leave work to come get the child, that's another indicator.
Yeah. So what kind of symptoms would you see, especially as we get into more toddlers, where you might start thinking, this is becoming a little, too much to manage?
Yeah, toddlers may not yet have the language to tell us what they're feeling, or they don't even know that they're feeling worry or fear or anxiety. And so sometimes it comes out as behavior, the crying, the tantrums, anger. And so any change in behavior that we're noticing around these new activities is an indicator. Avoidance too, if they don't want to do activities that normally you see that they like to do, or they don't want to be around certain people, that's an indicator. And then for children and really adults too, anxiety can be very somatic. So we feel it physically. Experiences of pain, like my belly hurts, those are all indicators that stress is happening.
Yeah. And then once, and that may be how a parent first picks up that there's something going on, right? Because their child's saying my belly hurts all the time, but they don't have vomiting or diarrhea or fevers or anything else. Because there are physical things that can also do that, but certainly anxiety ought to at least be in our minds as a possibility, right?
Yes, absolutely. I think especially the toddlers, they can describe to you when they're feeling something in their body a lot more easily than to say, I am afraid of this new person, or I'm afraid of this situation. And I mentioned my 2-year-old earlier. That's what's happening. If we're reading a book where there's screaming or something that's scary, she will start saying belly and touch her belly. And she doesn't know that that's why her belly's hurting, but that indicates to me, oh, she's feeling nervous about what we're reading.
Yeah, that definitely makes sense. And then what do you do for these kids? Like once you figure out, okay, this is an issue, they really are having anxiety, it's impacting their life or their family's life. From a psychologist perspective, what can we do about that?
So 2 big things. One is we want to normalize and validate the emotion and label it for them. So yeah, your belly feels different right now. That's because you're afraid. That's because you're nervous. Point it out in yourself and in characters in the books or movies so that they start having the language and understanding of what their body's feeling. And then the other big thing is we want to continue the exposure, continue doing that thing despite the fear. So yes, I can tell that you're really nervous right now, and we're still going to do this because if we hide from that fear, it's just going to get worse. And so we want to keep pushing our little ones to try those things.
Yeah. And, letting them know, okay, at the end of the day, I'm going to come back and I'm going to pick you up, and then maybe we'll do something fun and exciting that you can have to look forward to. Just that positive reinforcement. And because when you come and pick them up, then you've started that pattern, right? And it's going to be much more difficult the next day when now you can't go pick them up, right?
Yes, absolutely. If you pick them up early because they're feeling afraid, then we unfortunately reinforce that. And so again, that fear is going to grow versus empowering them and showing them you can handle it. Here's some ideas, here's some strategies. With really little ones, it's harder to teach those strategies, but something like blowing bubbles, reading a fun book, dancing to music to distract them and help them relax can be really helpful.
Yeah. And the parents may need some help with this too, right? Because I imagine, seeing your child like waving to you out the window and they got the tears coming down, and then you get the mom guilt that I'm leaving my kid here and they're upset. So, I mean, sometimes moms need to talk these things out too, right?
Oh, yes, absolutely. It's really hard to do. And you almost have to remind yourself, like, I am doing this to help them learn these skills that will help them later on. Yeah. I'm only helping. Yeah,
very, very important. From a psychiatry perspective, Kristina, is there anything additional for these young kids that they may or may not need?
So typically we would not think about kind of a medication, definitely as you were talking about, helping parents. And so sometimes, parents may need to work with a therapist, or if a parent already experiences a lot of anxiety themselves, helping them know and making sure they're taking good care of themselves. Because we know that anxious parents, oftentimes that can translate into anxious children. So helping parents see that. And so sometimes what we're doing more in a visit is recognizing it in the parent and helping them seek services for themselves to be able to take good care of themselves.
Yeah, kids really do pick up on those little nonverbal body language kind of stuff in an amazing way. And so if a parent's really anxious about something, maybe a parent's anxious that it's going to thunderstorm. Maybe they were in a tornado when they were a kid, or something that makes them be very anxious about storms. And then it's easy to see, well, the kid looks to mom for comfort. Is everything okay? And then they can start to have those same anxieties. So it is important to think about the parent too, right?
Absolutely.
Yeah. Let's go ahead and move on to school-age children. Now, the school-age kids, they have a lot more reasons to be anxious, right? What are some of the more common causes of anxiety in school-age kids?
So now that we're in school age, school's probably one of the biggest ones, and all that comes with school. So whether that's separation from our loved ones, whether that's worry about, am I good enough? Am I doing well enough in school? Am I going to make friends? Am I going to fit in? How are other people going to treat me? We have some children who kind of wander into more perfectionism. I have to do perfectly on these assignments. And then there is just all that comes with being out and about in the world. Traumatic experiences, even hearing others talk about traumatic experiences can cause some anxiety.
Yeah. And there's just so many different things that can do it, right? I mean, at school, it may be the school work. It could be, they're having difficulty with that, or it could be interactions with teachers, interactions with friends. How do you, if you figure your kid's got anxiety and it's related to school, maybe they're avoiding going to school. How do you get at what exactly the anxious point is for them?
Sure. So we talk a lot about kind of trying to, what are some fun parts of the day? So we kind of always try to start with the good. And then once we kind of, it might take some coaching and things. I always tell kids, I never hear anything bad about gym or recess or lunch. So we can usually start there. And then we kind of move into, okay, so, is it math? Is it language arts? And then asking questions about, so is it hard to ask questions if a child's in math really not understanding? Is that what makes it so hard? You don't understand, or you're afraid what your friends might say if you ask a question? Or is it more socially? And then we might hear a little bit about, well, I like recess, but, people don't want to play with me anymore. And so trying to kind of sort out what part of the day it's coming in. And then we can ask more detailed questions on, what is it, what's kind of going on. The other thing I tell parents is kind of looking at time of day. So if you have a child who's showing up in the school nurse's office, is there a particular time you're getting that phone call? Every day at 2:00, for example. That can help prompt you to kind of ask around 2:00 what's going on. And that can help provide some clues.
Yeah. And a lot of this is just having a conversation, right? And just, kind of, as you said, going through the day, start with the good parts of the day and see where it goes. That's a great technique. What kind of symptoms would point us to the fact that your kid could have an issue with anxiety that's, becoming a problem during the school age years?
Absolutely. So as Dr. Hoet was saying, in babies and particularly in toddlers, somatic symptoms, we see a lot of that in the school age. Headache, stomach ache are probably the most common. Also the general, I don't feel well, I don't feel good, frequent nurses visits during the day without any other symptoms of illness. You can see kind of, I see it as kind of two groups. We have children who are kind of more sad, down, shut down, don't really want to talk or engage. And then on the other hand, you can have children who are more externalizers and that they are acting out. That can look like aggression. That can look like disrespectful interactions with the teacher or peers. It can look like running out of the classroom. And so those are kind of some of the big things I look for. Certainly changes in sleep and appetite are another big ones that kind of tell us something's going on.
Yeah. And then once you figure out something is going on, how do we handle that one from the psychology perspective?
I think that depends a lot on where we are in the range of anxiety, right? If we have a kid that's showing that normal fear, anxiety, it's having the conversations, as Dr. Jiner mentioned, trying to figure out the root of the anxiety. What thoughts are you having? Are you feeling like you're going to be judged by your friends? Are you afraid you're going to fail a test? And trying to understand where that emotion is coming from. Anxiety is also very connected to our physical body. And so we feel that muscle tension, the pain. And so helping kids learn relaxation strategies, those belly breathing exercises, progressive muscle relaxation exercises. And then again, the exposure piece. Keep doing those things that we're afraid of little by little. Sometimes they require some baby steps. When it is more severe anxiety, where it's really getting in the way of school success or socializing, we start to think about therapy and maybe implementing things like an IEP or 504 plan at school so that maybe a child has the ability to take a break during the school day to practice those relaxation exercises, or maybe they have the ability to have more time for a test so that they can be a little bit less stressed about that.
Yeah. Anxiety can also go along with other mental health issues and behavioral health issues. How do you tease out whether it's just plain anxiety over something that's happening at school that your child is not engaging well with, or if they really have a learning problem that could be the underlying cause of their anxiety, or attention deficit hyperactivity disorder? Like how do you know when it's just anxiety and when maybe there's some other things going on as well?
That's one of the things that we have to figure out when we're doing a diagnostic assessment with a child, because a kiddo who's anxious may have difficulty focusing, may be having a hard time learning. And so we have to figure out, is that anxiety or is that difficulty focus coming from too in my head and nervous and thinking about all these things that make me nervous? Is it that it's ADHD and it's harder to focus? Or is it that I'm not learning? It's hard for me to learn, and that's why I can't focus. Or because I'm having a hard time learning, then I start feeling nervous because I know that, something is getting in the way of my success. And so now I start to develop this anxiety about school. So we do have to tease that apart with the different questions that we may ask a child, a parent, or the teacher.
Yeah. And this is a good reason to get professional help when your child has anxiety, because it can get pretty complicated. And really we get into which came first, the chicken or the egg? And, difficulty concentrating can cause anxiety. Having anxiety can cause difficulty concentrating. So it really just becomes a looping pattern. And to stop that, you really do need to see someone, who is a professional and can help you through. From a psychiatry perspective, are there medical indications for treatment with medicine at the school age, during the school age years?
Absolutely. So it's something we look at, first and foremost are, as Dr. Hoet was saying, the coping skills, the therapy. We start always with that. And then if we find that the anxiety is so impairing, it's just a child is not able to make it into the school, they're not able to do day-to-day things, then we will use medication. Or if a child has been working in therapy, working hard, doing their very best, families helping support that, and we're not seeing that progress, then we would look to medication. Again, as I always tell everyone, medication is simply a tool to help the child do all the other things that they're doing. Medication cannot replace therapy. They need to be done concurrently together, but it really just helps kind of take the edge off, so life is a little easier.
Yeah, that makes sense. Is there a certain age at which you start thinking about medication? Is there too young for medicine, or is it not age driven at all? It's really more what the problem is.
So I think there is we're more hesitant, of course, the younger the child. And so certainly we would pursue and push more for therapy options in our, 3, 4, 5-year-olds. We feel a little more comfortable. We have a little more research once we get into a little bit older children. But still, again, those therapy techniques are really important. But we do consider medication for a child if it is that impairing. There's really no lower age limit, if you will.
Do you see depression with anxiety in school age kids, or is it an either or kind of thing?
So that's a great question. So it's, and again, another one of kind of those chicken versus the egg. So if you have untreated anxiety for long enough, it can morph into what looks like depression. A child who's now hopeless, things are never going to get better. It doesn't matter what I do. I'm always anxious. I'm always going to feel this way. Versus a child who has anxiety, and that's clearly there, but there's also a separate depression. So sometimes we're sorting those out. What we know is that one of the wonderful things is that the treatment, whether from a therapy standpoint or medication, is the same. It's very similar for both. So we treat one, it's naturally going to treat the other.
Yeah.
But we do have that question of which is which.
Yeah. And so it's not just adults. Kids can have anxiety and depression as well, and even very young kids, right?
Yes.
Yeah. Let's move on to teenagers. So now we have even more reasons and causes for the stress and then anxiety in teenagers' lives. Ariana, what are some of the common causes of anxiety in our teenagers?
We think about the same thing that school-age children are experiencing, the social acceptance and possible social anxiety, the pressures of school and performance. Adolescents start to think about their future, and that can be really stressful. They also are more aware of what's going on in society, and today's adolescents are very in tune because of social media and access to so much information, and that can be really stressful.
Yeah, absolutely. There's also issues of gender identity and sexual identity that can come up in the teenage years. Do you see a lot of that causing anxiety in kids?
Yes, I think adolescent years are a time for just developing your identity, sense of self in general. So whether it is gender or sexual identity, also children who are of diverse racial or ethnic backgrounds, if they're experiencing racism, that's going to impact how they feel in the identity, the self that they're developing. Yeah. And so all of those factors also weigh on an adolescent experience.
Yeah. So we asked this question for the younger kids. What about at this age, in the teenage years, how can parents best get a handle on what might be causing anxiety in their child? If they've thought about that, there's so many things that it could be. Maybe your child doesn't want to talk about it. How can you help those conversations along?
Yes, I think that's why it's so important to build the habits of talking to our kids from a young age, right? Making it normal and comfortable where every day we're checking in and talking about many different things so that when something difficult comes up, like I am worried about your mood or your behavior, then it's a little bit more natural. And then just asking directly, I've noticed your grades have gone down, or I notice you don't want to do social events anymore. Is there something going on? Are you feeling nervous? And then trying to ask those questions to get at what's going on.
Yeah, that makes sense. What kind of symptoms would cue a parent into thinking about anxiety in their teenager?
Similar to what we've been discussing, any changes in behavior where now a child is avoiding certain situations, showing that irritability, difficulty focusing, difficulty with sleep. I hear in a lot of teens that experience stress and anxiety, changes in appetite. So, as a parent, you may know your child best. And if you start seeing any of these changes, that can be a cue.
Yeah. The sleep thing, not only can anxiety cause you to not sleep well, but if you're not sleeping well, that can also cause anxiety, right?
Yeah.
Again, another one of those vicious cycles.
Mm-hmm. Absolutely.
What advice do you have for teens who may be having insomnia?
We talk about a few things. One of my favorite things to talk about in therapy is scheduling a worry time. So, your brain will worry and keep you awake and think too much. But if you start scheduling a time, maybe an hour before bed, where you sit down and you allow yourself to worry for 15 minutes or plan ahead, think about what you're going to do, just let your brain go. And then you're done. You do something that's distracting, relaxing, help yourself wind down, and then get to bed. That kind of builds the habit of telling your brain this is the time to worry if you do it at the same time every day. And so it keeps you from being in bed and worrying too much.
And don't do it in bed.
Don't do it in bed. We want your brain to learn that my bed is the place to sleep only. So if you're worrying and it's been a long time and I can't fall asleep, get up, go worry somewhere else.
Yeah, maybe even a different room of the house. You can have your worry closet. All right. And then in terms of management, how do we go about, from a psychology perspective, managing anxiety during the teenage years?
So again, it depends on that continuum, right? If it's not at the anxiety disorder stage, then we talk about those physical relaxation exercises. Keeping yourself on a schedule and a routine can be really, really helpful if you're experiencing stress. So making sure you're going to bed at the same time every night, making sure you're scheduling physical activity, wind down time, even that worry time if necessary. Trying social distractions. We know that having social connections and a social network is really helpful and protective against stressors. And then if it does get to the place where it is an anxiety disorder, that's when we recommend certain therapies like cognitive behavior therapy, exposure therapy, or the discussion for medication.
I want to head back there to the social media thing. And you were saying that, being connected with your friends and with family who may be far away and being able to network and engage online can be a great thing. But we know that you can also kind of overdo that too, right? Mm-hmm. What is a good way to sort of moderate how much social media time that a teenager is getting?
It's two big questions that I like parents to think about. One is how much time, right? It's all about a balance. If I'm spending too much time on social media, then that means I'm not doing something else. So if your teen is pretty active and doing a lot of social activities, extracurriculars, and spending some time on the internet, then that's okay. The other thing that I like parents and teens to think about is, what is the purpose of social media? What am I doing when I'm on it? If I am on social media and I'm connecting, I'm learning, I'm doing something fun, I feel good while I'm on it, great. But if I start to do some comparisons and feel like my life is not as fun as this person, or I don't look as good as this person, or I start to feel left out, certain group of kids went to a party and I didn't get invited. If I just kind of feel yucky and sad or anxious after being on social media, that's an indicator that I have to start using it differently.
Yeah, great. And again, it's just a conversation you have to have. And the earlier you start having those conversations, the easier it'll be when your kids are teenagers, right?
Absolutely.
Yeah. And then from a psychiatry perspective, especially during the teenage years, you may be more likely to use some medications, right?
Absolutely. So we do are more likely to use them. And I would say also, too, some of the things we screen for in psychiatry at the teen years is slightly different. Substance use being one of the big ones, oftentimes used to treat anxiety from the teen's point of view, but can also worsen it. So before I'm going to think about use of medication, I want to screen very closely for that. And if it is there, kind of address that too. Addressing sleep, as we talk about, is a big one. So oftentimes that's what I'm focused on first. And because good sleep leads to lots of great things during the daytime, including being able to cope. And so oftentimes that's what we're targeting first before we even go after the anxiety.
Yeah. Do you see many kids with maybe undertreated ADHD in the teenage years than having anxiety because of school issues, friend issues, substance abuse issues, that if their ADHD was under pretty good control, it might not be as troublesome?
We do see that quite frequently. And in fact, in some cases, we'll start to pick up on new cases of ADHD that we didn't realize were there until we start to see this anxiety spike. And then we dig a little deeper and realize, oh, that might be what's going on. And you can't focus. And so your peers are excelling in class and you're really struggling to keep up. And so we really look for that too. And again, that diagnostic assessment to say, might there be something else going on that if we adequately treat that, then we see the anxiety naturally get better on its own.
Yeah. There's some families, that may be resistant to medications for ADHD, but also for anxiety, for depression. What I'm sure you kind of walk through with them sort of risk benefit to help them make informed decisions.
Sure. So we always talk about, there's benefits to medication, but there is risk. And at the same time, we talk about there are benefits to not starting a medication, but there's also risk. And so we're weighing those risk versus risk. And I walk parents through kind of my thought process. And this is what we're seeing with your child. And I'm concerned that if we don't do something different, and that something different could be many things, we might see worsening of symptoms. And we do know with anxiety, and I don't think this gets talked about enough, but if anxiety is severe enough, we will start to see things like self-harm, suicidal thoughts, suicide attempts. And so those are the things that we definitely want to prevent. And so we'll talk about the risk versus risk.
Yeah. A couple episodes ago, we talked about suicide in teenagers. And I just want to bring it up again now because I think it's so important. Talking to our teenagers about suicide is not going to put that thought in their heads, right?
That is absolutely correct. So study after study has shown that discussing it is not something that's going to make it happen. And so we encourage talking about it. We talk about it in the office in a very open way, and encourage parents to do the same with their teens, and encourage teens to talk to adults about it as well too. And knowing that, as I tell teens, nobody wakes up in the morning and says, hey, I think I'd like to have these thoughts today. So if they show up, you're not in trouble. You didn't do anything wrong. It means that something's going on. We need to learn more about it. Yeah. So really encouraging that open dialogue.
Yeah, definitely makes sense. We talked about with the littler kids that they're really paying attention to parents and their reactions and behaviors toward things. Teenagers are doing that as well. And so this may be a great time that if you, as a parent, do have anxiety, depression, just not feeling right, trouble at work or trouble in relationships, that you can really be a model for your teenager by getting help yourself. And then your teenager is going to see, hey, mom is in counseling, then, maybe that's something that I need too.
Absolutely. And it also will affect the relationship with your teen. And so, modeling your parent who's seeking treatment, seeking help, talking about these things, almost normalizing discussion of it, normalizing treatment for it. It can really help the teen be like, you know what, I can do this. And I talk with a lot of teens about, we talk a lot about depression, not quite as much about anxiety sometimes. Lots and lots and lots of people are feeling anxious. So really understanding that, hey, I'm not the only one. My parents facing it, they're getting help. I can get help too and feel better.
Yeah. In my immediate family, we're on 3 different SSRI kind of medications. And so it's, I won't mention who or which ones or anything, but we all need help. Yes. And especially in the time of pandemic and wars and, going back to school after you've been home for so long and in the different models of school, these are hard days, right?
Yes, these are. And no one can do anything alone, right? So we're not alone. We have tools, we have resources.
Yeah, absolutely. What about kids with chronic illnesses? Are those a special case? If you have kids with diabetes, they may have really bad asthma. Kids with cancer, for sure, eating disorders. There's a lot of underlying just medical conditions that then can manifest anxiety or make anxiety that was there worse, or maybe even cause anxiety. Do you see that relationship a lot?
We see that quite a bit. I think asthma is a perfect example. Not being able to breathe is going to generate a lot of anxiety for a person. And then even when your breathing is fine, your brain may worry. Am I going to start having trouble breathing again? And that can actually start symptoms that look very much like an asthma attack. And when we try to treat it, we find, no, it's anxiety. So I encourage folks we need to talk about this, right? So in addition to asking a child, how's your breathing today? Or how's your blood sugar today? How are we doing with that? But to ask about that anxiety, because it's real, it's there. The child may not have been able to put it into words yet until you give them the words and help them understand that, this is pretty typical. And we can help with that just as much as we're helping with the breathing or blood sugar control.
Yeah. And that's one of the great things about Nationwide Children's Hospital is we just have such a great behavioral health program that those kids who are, seeing a cancer doctor, seeing a sports medicine doctor, seeing their doctor for diabetes, they really can get plugged into counseling pretty easily because everything is so integrated here, which is really fantastic. That leads me to the On Our Sleeves movement. And I know, Ariana, you are the clinical director of On Our Sleeves. Tell us about that movement.
Yes, so On Our Sleeves is the movement for children's mental health. Our mission is to provide free, evidence-informed resources to every community in the U.S. And so what that means is we are putting out content and information, whether through our website or our e-community or through teacher curriculums, that is all based on evidence and science, and it's really created by the experts here at Nationwide Children's Hospital.
Yeah, but really nationally facing so that anyone can go to onoursleeves.org and get information. And there's tons of resources at that site, right?
Yes, there is so much information, and it is free, and anyone, anywhere can have access to it. And really, we focus on that mental wellness and just like we talk about healthy eating and exercise with children, we want us to also be talking about how to keep a child mentally healthy.
Yeah. And we'll put a link to On Our Sleeves in the show notes so folks can find it pretty easily. Episode 516 over at PediaCast.org. And then we have our Big Lots Behavioral Health Services at Nationwide Children's, which is really a very large behavioral health program, really one of the largest ones in the country. Tell us, Kristina, more about that.
Yeah, so we have a very comprehensive team approach across the continuum of care. So we have everything from your traditional outpatient services, whether that be therapy or psychiatry, to more intensive programs, our partial hospitalization program, for example, or for those children who need extra care. We have our psychiatric crisis department for evaluation. And if the need arises, we have inpatient psychiatric admissions that we can do to help a child, keep them safe, stabilize their symptoms. Our department participates in our other medical subspecialties, as you were talking about. So we have psychiatry over at the main hospital who consults with our teams, as well as our psychologists who work with the different subspecialties. And so we have a continuum of care that is pretty amazing and touches, I think, most, if not all, parts of our hospital system.
Yeah. And we'll put a link to the Big Lots Behavioral Health Services at Nationwide Children's in the show notes. And we also have our mood and anxiety program at Nationwide Children's, and we'll put a link to that program as well so folks can find it easily. Lots of other resources in the show notes this week. We have articles, what we call here at the hospital Helping Hands, which are handouts that go along with parents when they leave with more information about particular conditions. And then our 700 Children's blog has had a lot of posts related to anxiety. And so I've collected an assortment of resources that folks will find in the show notes. Just some examples, anxiety disorders in children, just sort of an overview, how to ease your child's separation anxiety, sports performance anxiety, and preparing your child for optimal play, panic attacks and versus anxiety. What's the difference there? Which I should have asked. When we were talking about anxiety, we didn't really mention panic. How's a panic attack different than anxiety?
Sure. Great question. So I describe a panic attack as all of a sudden an intense, overwhelming sensation of anxiety that's often accompanied by physical symptoms, shortness of breath, feeling like your heart's beating out of your chest, dizziness, weakness, even some tunneling of the vision growing black. And those can be triggered. Something can happen and cause a panic attack, but they can also come out of the blue, which is what makes them one of the most kind of scary situations if you can't figure out what caused it. And over time, it can cause things where children start to worry about having more of them. And so certainly we treat them and address them, but not an uncommon thing we see.
Yeah. And as I've interrupted myself here, but I think this is an important important point to interrupt. And just like panic attacks can happen without necessarily there being a trigger, we should also mention that anxiety is the same way, right? Sometimes you can't pinpoint what is causing anxiety. Sometimes it's just there.
Yes. And so we have many children and teens who describe, I don't know what I'm anxious about. I just feel anxious. I know I'm anxious. And so we can, even if we don't know what the trigger is, we can still treat it. We can still evaluate for it and help a child feel better.
Yeah. A lot of physicians have anxiety, I think just as a baseline, because that's just the kind of, we're built that way. And maybe that's how we made it through medical school. And so there's a lot of anxiety among us. And I can say for myself, it's just like a feeling of just being revved up, and it's like you can't rev back down. Like I just need to downshift, and it won't happen. But medication does help with that. So yes. I would just say that as a public service announcement, and my wife would agree. All right, so lots of stuff as I mentioned in the show notes. We also have a behavioral health playlist on SoundCloud. It's just past episodes of PediaCast that have dealt with behavioral health issues. So if you're interested in these topics, I'll put a link to the playlist in the show notes so you can find it, because we have definitely covered lots of behavioral health things in the past, and we will certainly cover more of them in the future. And as I mentioned, both of you are going to be coming back as we do that, journeying on down the year. But for now, I just want to thank both of you for stopping by and talking about anxiety with us. So once again, Dr. Ariana Hoet, pediatric psychologist, and Dr. Kristina Jiner, pediatric psychiatrist, both from Nationwide Children's Hospital. Thank you so much for being here today.
My pleasure. Thank you.
Thanks for having us.
We are back with just enough time to say thanks once again to all of you for taking time out of your day and making PediaCast a part of it. Really do appreciate that. Also, thanks once again to our guests this week, Dr. Ariana Hoet and Dr. Kristina Jiner, both with behavioral health at Nationwide Children's Hospital. Don't forget, you can find PediaCast wherever podcasts are found, or in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. Our landing site is PediaCast.org. You'll find our entire archive of past programs there, along with our show notes, our terms of use agreement, and that handy contact page if you would like to suggest a future topic for the program. Reviews are helpful wherever you get your podcasts. We always appreciate when you share your thoughts about the show, and we love connecting with you on social media. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. Don't forget about our sibling podcast, PediaCast CME. That stands for Continuing Medical Education. It is similar to this program. We do turn the science up a couple notches and offer free continuing medical education credit for those who listen. Of course, that includes doctors, but also nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And since Nationwide Children's is jointly accredited by many professional organizations, it is likely we offer the exact credits you need to fulfill your state's continuing medical education requirements. Of course, you want to be sure the content of the episode matches your scope of practice. Shows and details are available at the landing site for that program, PediaCastCME.org. You can also listen wherever podcasts are found. Simply search for PediaCast CME. Thanks again for stopping by, and until next time, this is Dr. Mike saying stay safe, stay healthy, and stay involved with your kids. So long, everybody.
This program is a production of Nationwide Children's. Thanks for listening. We'll see you next time on PediaCast.